Dear colleagues, welcome to Barcelona for ESMO 24, and we proudly bring you this OncoAlert roundup. So please note that these are just some of our picks, and if you want to dive deeper into these trials, you can sign up for our newsletter at the link found in this post, or you can go to www.oncoalert360.com and sign up. That's www.oncoalert360.com. So starting off with three concomitant publications. So out in the New England, we have the Adriatic trial with durvalumab after chemoradiotherapy in limited stage small cell lung cancer. And here, durvalumab significantly improved both overall survival with a median 55.9 months versus 33.4 months, and progression-free survival with 16.6 months versus 9.2 months compared to placebo. So adverse events were comparable between durvalumab and placebo groups, with slightly higher rates of discontinuation and death in the durvalumab group. The durvalumab tremelimumab results remain blinded, but durvalumab alone did demonstrate a clear efficacy in this setting. And out on the Lancet, the TiNivo-2 trial, where tivozanib plus nivolumab versus tivozanib monotherapy in patients with renal cell carcinoma following an immune checkpoint inhibitor. Here, the study found no significant difference in progression-free survival between the two groups, with tivozanib monotherapy showing a median PFS of 7.4 months compared to 5.7 months for the combination therapy. The results suggest that immune checkpoint inhibitor rechallenge should be discouraged, and tivozanib monotherapy may be an effective treatment option in the post-immune checkpoint inhibitor setting. And the final publication was out on Nature Medicine, TDXD in HER2-positive advanced breast cancer with brain metastasis. And here we saw demonstrated significant and durable activity in the brain metastasis cohort. The 12-month progression-free survival was 61.6%, and the CNS-specific PFS was 58.9%, while the non-brain metastasis cohort had an objective response rate of 62.7%. Grade 3 or higher adverse events occurred in about half of the patients, with interstitial lung disease or pneumonitis reported in both cohorts. These findings support the use of TDXD in HER2-positive metastatic breast cancer patients, regardless of brain metastasis status. And moving on to other trials at ESMO 24, the Icarus Breast 01 trial, which is a phase 2 study of patritumab deruxtecan, which is HER3-DXd, in patients with hormone receptor positive, HER2 negative advanced breast cancer. The Icarus Breast 01 study found that HER3-DXd demonstrated significant clinical activity and manageable safety profile in patients with hormone receptor positive, HER2 negative advanced breast cancer who had progressed after prior treatments. And moving on to kidney cancer, the LIGHTSPARK-005 trial, where belzutifan versus everolimus in participants with previously treated advanced clear cell renal cell carcinoma. And here we saw belzutifan outperform everolimus in progression-free survival and objective response rate for advanced clear cell renal cell carcinoma, though no significant overall survival improvements were observed. And finishing off with IMbrave 050, a phase 3 study of adjuvant atezolizumab plus bevacizumab versus active surveillance in patients with resected or ablated high-risk hepatocellular carcinoma. Here, the results show that while atezolizumab and bevacizumab initially improved recurrence-free survival in high-risk ACC patients, this benefit was not sustained, and the overall survival data remains immature, suggesting that this combination may not be suitable as a standard adjuvant therapy for all high-risk cases. And there you have it, folks, our day one wrap-up. We thank everybody for your support, and we look forward to seeing you at the Congress.